Hello friends, and this is a bacteriology buzzword series, and this is a part 3, and it will be a little long series because this will be a final for the bacteriology clue words. Okay, so we'll start the session. So first the clue is it is an obligate intracellular organism and cigar-like bundle bacilli, and there will be an Virchow cells, that is a lipid layered macrophages. Okay, this is called as an Virchow lepra cells, and Leonine phases will be there, and early Fernandez reaction in which 0.1 ml of lepramine antigen will be injected intradermally in the forearm. Okay, so after 48 hours there will be an erythema. If it is more than 10 millimeter, then it is considered to be an positive. So next it is in for Mitsuda reaction, you will be observing it after 21 days. So you will be seeing a nodule which is measuring about more than 5 millimeter, then it is seems to be positive. And then the culture is usually done in 9-banded armadillo or the foot pad of the mice. Okay. And then you want to know about the lepra reaction. There are type 1 and type 2, and type 1 belongs to type 4 sensitivity, and type 2 belongs to type 3 sensitivity, okay, hypersensitivity. Okay, so 1 is 4 and 2 is 3. How you can remember is you have to get the total number of the 5. So 1 plus 4 equal to 5, 2 plus 3 equal to 5. So if you come across these words, then it is in Mycobacterium leprae. Okay. Next it is in some of the one-liners we can see. For first it is a Mycobacterium marinum, usually causes swimming pool granuloma or the fish tank granuloma, and then swimming pool granuloma or fish tank granuloma. And then Mycobacterium scrofulaceum causes scrofula or scrofuloderma, and then Mycobacterium ulcerans causes a Burudi ulcer. So these are the important points. So you want to remember for Mycobacterium, non-tuberculous Mycobacterium. Okay, so next it is a mycolic acid layer which is responsible for acid fastness, and the most common form of extrapulmonary tuberculosis is tuberculous lymphadenitis, and the most common nodes involved is one is posterior cervical nodes, and it's a supraclavicular lymph nodes. And then apple jelly nodules, it is skin manifestations of the tuberculosis. Okay, so if you come across these words, then obviously it is a Mycobacterium. These are some of the important points you want to remember for the Mycobacterium tuberculosis. So this organism usually causes a food poisoning. So for that, the toxin is type A enterotoxin is responsible for food poisoning, and then Enteritis necroticans, and it is also called a gas ganglion of the bowel or the pig bill. So next is necrotizing enterocolitis is caused again by type A toxin. It causes a gas gangrene. So I will be revealing this organism name at the end. So target hemolysis, Naegele's reaction, reverse Camp reaction, and litmus milk shows a stormy clot reaction. So if you come up to this point, it is in Clostridium perfringens. So what I told is about the gas gangrene, it is a P, N and the S, that is Clostridium perfringens, Clostridium novae and Clostridium septicum. Okay. So next, so I think you can easily diagnose the organism, or you can guess the organism by the name Tetanolysin, Tetanospasmin, Rhizus sardonicus, Opisthotonus, or 8th disease, or Trismus lockjaw. And RCM usually shows in proteolytic, that is usually it is in black in color. Whereas acrolytic organisms, the RCM broth will be pink in color. Okay, so if you come across these words, then you can close your eyes and you will be marking as Clostridium tetani, but they won't give this clues directly. Okay, so a patient after developing a bullet injury, and he developed muscle paralysis, then lockjaw. So next, so he was obtained some abnormal position on the 5th day. Okay, and on culture the broth shows an proteolytic. So like clinical questions only will be getting an examination, but you can make a diagnosis with these points. Okay, So then, okay. So here, first it is a powerful neurotoxin. Actually this toxin is enough to destroy the whole mankind, okay. And then there'll be clue like floppy child syndrome and 5Ds: diplopia, dysphasia, dysarthria, descending symmetric flaccid paralysis, and decreased deep tendon reflexes. If you come across these words, it is in Clostridium botulinum. So again here there will be history like the patient has taken some of the home canned food. After that he developed these 5Ds like some loss of vision or difficulty in speech. So on examination we found there is a decreased deep tendon reflexes, and what will be the probable organism, okay. So here it is a Clostridium botulinum. And hide-footed disease, it is a cutaneous anthrax. Wool-sorter disease, it is a pulmonary anthrax. Malignant pustule medusa-head appearance, it is usually seen in the nutrient agar, and in the culture there will be an inverted fitri appearance in the broth, and sting of pearl appearance, and bamboo stick appearance in the gram staining. It is in Bacillus anthracis. For Bacillus series, it is in Chinese fried rice. There is no other clue can be given for that. So next it is in Chinese letter or cuneiform metachromatic granules or Ponder strain, Albert strain, nasal strain, Park-Williams strain, and then pseudomembrane formation will be there, right? So that is it will be having an inner band of fibrin which is surrounded by neutrophil, RBC, and the bacteria will be there, and which peels off. And so then bull neck appearance and helix gel precipitation test and Schick test. If you come across these organisms, it is in Corynebacterium diphtheria. Next, so Corynebacterium minutiscens causes an erythrasma. So it is in skin lesions, and the important point is in inflorescence it will be emitting oral red color, okay. So in parvum it is an immunomodulator. So next, so it is a encapsulated lens-shaped bacteria. It usually ferments in glucose and maltose, and it can be seen either extracellularly or intracellularly, and usually present in the nasopharynx. And you will be coming across this word Waterhouse-Friderichsen syndrome, so which is manifested by rashes, shock, or disseminated intravascular coagulation, and bilateral adrenal hemorrhage will be there, and multi-organ dysfunction. If you come across these words, it is an Neisseria meningitis. So next, it is a non-capsulated kidney shape, ferments only glucose, intracellular. It is usually present in genital tract, urethra, cervix, and it is show some of the manifestations. Since it will be causing an urethritis, it can cause an portric and perineum. So the organism is Neisseria gonorrhea. So next it is in Moraxella lacrymata. It will be causing an catarrhal conjunctivitis or the angular conjunctivitis. M. protein, scarlet fever, necrotizing fasciitis, flesh-eating bacteria, pike transport medium. It is used. The main test is bacitracin sensitivity test is positive, means Streptococcus pyogenes. If bacitracin sensitivity test is resistant, POR test is negative. If CAMP test is positive, it is Streptococcus agalactiae. Okay. So if bile esculin test is positive and spectacle shaped bacteria, the most probable organism is Enterococcus. So next, so gram-positive cocci arranged in the pairs. So lanceolate or the flame-shaped, and Dortmund or the coram coin appearance. So these are the three important points you want to remember. So bile solubility, inulin and optacin. Okay. So bile soluble, inulin get fermented, optacin is sensitive. The organism is Streptococcus pneumoniae. Okay. So again, so gram-positive cocci in long chains, and bile is insoluble, inulin is non-fermented, optacin is resistant. It's in virulence. This is just opposite to the pneumonia, okay, whereas there bile soluble, inulin fermented, and optacin is sensitive. This is for Streptococcus pneumoniae. So just for remembrance, I am writing over here. And then if the history of any dental caries, it is Streptococcus mutans. So gram-positive cocci in clusters, catalase positive, coagulase positive, and nutrient agar shows in golden yellow pigment, and there is in beta hemolysis in the blood agar, and mannitol salt agar is a selective medium, and Woodland's medium also used. So most commonly causes in the soft and skin infections and osteomyelitis. Okay, and this infection is most common in the healthcare personals. Means the only one organism it is in Staphylococcus aureus. Okay. Okay friends, I think the bacteriology buzzword series is finished, and just revise over this for the keywords so that you can easily diagnose the organism, and I'm sure some of the key points from this session will be there.